Hi everybody, welcome to the Q&A today with Dr. Cow, who's going to join us in a second. Today's Q&A is about school reopening in your city specifically. So first of all, we are going to get Dr. Cow on to join us here live, and he has a few words he would like to share with you before we get to the Q&A part of this live. Hi, Dr. Cow, welcome.
Hi, everybody.
Can you hear me?
I can hear you. Can you hear me?
Excellent. Yes, I can. So I was just going to go through a couple of housekeeping things before we start. So why don't we start going, Dr. Cow?
Okay, thank you. Thank you everybody for joining us. I know this is a loaded topic and, polarizing topic for a lot of people and stressful and frustrating for a lot of people. I just want to start with a little bit of perspective. New York City in March and April and May really slowed down a freight train. Our curve went up and down and got to a very controllable level because of all the measures that New Yorkers were undertaking. And it was a lot of sacrifice. I've had families of 4 that haven't left their house, in 3-4 months, only to come out and see me, So I know it was a lot of sacrifice, but it was well worth it. While we're looking at all these curves, ours went up and down at a very similar rate. Well, because we were all scared and terrified and taking serious precautions. But, there are places that are not so lucky right now, and they're having a lot like longer plateau and having to deal with like these high positivity rates, and subsequently hospitalizations and deaths that are going to follow. So we're very fortunate. The one thing that I think back about is 2-3 o'clock in the morning, listening to those ambulances every 5 to 10 minutes, and knowing that a lot of those people were going to go to the hospital and never come out of there. So we really have to have perspective and know that what we did really suppressed that and slowed the freight train and turned it around. So I'm super thankful for that. The other thing that I want to express is my thanks for our community and your support, just coming in, giving us a smile, giving us a knowing nod. Some of you have gotten lunch for us, and we've enjoyed every bite. I want to specifically thank our last supporter, Miss Coretta Johnson, who gifted us with a catered lunch last Friday.
Which she cooked herself, right?
Coretta, if you're on here and you have a catering site, just add it. We'll be happy to highlight your business, because it was delicious. It was flavorful, healthy, delicious, and delightful, just like you.
And can I say one thing about Coretta? So Coretta, Miss Coretta, is her daughter, but her family has been your patient since birth, and that is before SSP even was born.
Yes.
She followed you, although
15 years.
15 years. Although it was not convenient. It is still not convenient for her, and she's still one of our SSP families. So it is people like Coretta that make SSP, and everybody who's watching right now is an example of that. So thank you so much. And if you guys have questions for the Q&A part that will come right after the cow's little talk, please use the button down here. That if you can help me with your finger, right there, the question mark. That's the best way to ask questions.
Is that the question mark, or is that the?
It is the question mark right next to the comment section, the comment tab right there. Yeah. So if you can use that question mark to send me questions, and then I will read and ask the doctor. Okay. All right.
So I just a little bit of business. I just want to talk about the protocols at the office that we're taking the whole goal of public health and preventing spread is really keeping sick people away from healthy people and keeping them getting infected. So that's what we've been doing since March. We have not seen sick kids since March. Fortunately, in our environment, we do have options. If you have a fever, if you have viral symptoms, that you will be able to go to a place to be evaluated and seen. Our goal, and honestly, I'd love to see these sick kids myself, you know, but our main goal right now, until we know that things are very much under control, is to keep our environment safe, so that people feel comfortable coming in with their newborns, who do need to be seen more regularly, with their kids who need vaccines. Vaccine rates have dropped quite a bit nationally since March, and I fear, you know, what keeps me up at 3 o'clock at night is that, like, we're going to see some pertussis, we're going to see some measles as an insult to injury out of all of this. So our goal is to maintain as clean of an environment as possible, and most of you have been so wonderful in abiding by our protocol. I just want to go over them again, okay? Right now, we're only having one family check-in at a time. So if you do come and you do see a family at the counter, please wait by the door. We'll get that family back as soon as possible to an exam room, and then we'll buzz you in as soon as possible, okay? And then if we're asking that you bring only one parent per visit. Exceptions would be if you have twins, if you have multiple kids that are being seen that day that need more than one adult to help them, then that's okay. Outside of that, up until the 2-month mark, we are allowing for 2 parents to come per visit, okay? That's just to minimize the amount of traffic and respiratory droplets in the environment. And then if you are one of those families that are coming with 2 parents, when we do triage and weigh and measure and all that stuff, we do ask that one parent stays in the room while the other parent comes out to be with the child, okay? And then the other is that if anybody in the family has been COVID tested for any particular reason within 14 days, please let us know. If anybody who is going to be in the facility has fever, sore throat, cough, runny nose, diarrhea, we do need to know about that before the visit also, please. And then as far as the masking, anybody 2 years and up should have a mask over their nose and their mouths while you're in the facility. While we're in the room with you, we like to have the door closed in general, which probably will still happen with adolescents, to provide them a private atmosphere.
Dr. Kyle, are you there?
Sorry, yep, did you see me?
Okay, sorry.
I think, sorry. And then also, we may keep the door open for ventilation purposes. So unless we're venturing in any conversation that may need some more privacy, okay?
Yeah.
So I do appreciate all the measures that everybody's been following. So let's get to the topic at hand.
Yeah, hold on one second, if you don't mind. I want to answer a question that came through while you were talking, since it's on topic. So Becky, hi Becky, she wants to know, where do we send the kids that needs to be seen? Well, this is the thing, as you may not know, but let's go through it. The last patient that we saw in person, last sick patient that we saw in person was on March 19th of 2020. Since then, we have still been seeing, we have seen sick patients, except that this time around, we're doing that virtually. So we're able to still help you and assess if your child is sick, and we'll do that virtually. And usually the urgent care, right, Dr. Kyle, like we send them to the urgent care if they need to be swabbed for COVID, or if if there was a fall and we need to do X-rays, which is something that we would have done anyway in person. We would have sent to urgent care for an X-ray, correct?
Correct.
Yeah. So all strep and everything else, right now, we base that decision on clinical assessment, correct? And we still can help everybody doing a virtual visit. So if you do need a virtual visit, just call the office, email us, send a message to the portal, and we'll be happy to help you. Before we keep going, I want to say a couple of highs, because I saw a couple of people coming in. Dom, Thomas and Joseph's mom, hi, I saw you, you said hi. And then we saw super nurse Taima join. Hi, Taima. And I want to say my personal hi to my friends. I saw the Zappos friends are in the house. Hi, Krista. Hi, and Molly. Thank you so much for joining. Dr. All back to you again.
All right, thank you. So let's talk about daycare and school reentry. First, I really want to highlight that there is no easy answer. It's very unlikely a wrong answer, and there's no across the board right answer for everybody. You have to have the right answer for yourself. I know that's ambiguous, but you know, everybody's family is a different equation, and hopefully what I want to approach today is to give you the evidence of where we are so that you know how much you need to be worried, and if there is any concessions that you need to make, and then you know, make a plan with you, and we can do this individually. If you want to call the office and set up a consult, that's fine, but hopefully this will allay a lot of your concerns. So, and the other— I'm not sure I understand. Oh, sorry, Siri. She never understands me.
Wants to be positive.
Yeah, I think it's a racist thing. So the other thing that I want to touch on is that I know this is a very frustrating experience. Like, I don't know anyone who's really not frustrated about it or anxious about it. I want you to realize that all of this has been put on the teachers and the principals, and I really want you to do your best to not take out frustrations on them. These are the same people that we're willing to pay $1 million to have our kids back in school in April. We all want to get back to normal. We all want to be productive and part of the world again. Unfortunately, that's not a reality at this point with where we are with this pandemic. So until we get to a controlled state, we all have to make some concessions and be flexible. And please be flexible and kind in the way you express your frustrations with the people who are loving your kid and working very hard for working for your kids, okay? So with that in mind, I'm gonna just put a little bit of evidence out there that is more now that we know a little bit more about kids and COVID, okay? So the evidence is showing that kids are not the super spreaders that we had initially thought that they would be. You know, anyone who's talked to me about daycare and such knows that I know that kids between 1 and 5 are, they just don't know their boundaries. They're mobile, they're in each other's faces. And as soon as one kid in preschool gets something, everybody else gets it, okay? But this is not showing particularly true with COVID at this point. You know, kids are susceptible, just as susceptible at contracting it as adults, less likely to be hospitalized and less likely to have severe symptoms. But what we're finding is that kids who do get it are more likely to get it from household contact. So it's their adults giving it to them and not their friends in their peer groups, okay? So that's a plus for, you know, school and being in that setting. We do know that kids can get sick. At this point, we are also finding out that kids under 12 should be perked up. So people who have kids who are in daycare and considering daycare should really have this factor in. They're still less likely to get severe symptoms, but when they do get hospitalized, 33% of them, 1/3 of them are actually getting admitted to the ICU. Part of this is because they're small bodies and small airways and small lungs that can get compromised quickly before we can jump on it. So, admitting to an ICU setting to give them full observation and minute-to-minute observation is the prudent thing to do. I think that plays into the decision-making of whether or not they're going to an ICU versus an adult who's totally has to be intubated, and sedated to go to an ICU setting. The other thing that may play into it with some of your older kids is that asthma does not seem to be as big of a deal, as big of a contributing factor. I would still put it a little bit elevated. So if you have a kid that has chronic persistent asthma, I would probably consider that a half step risk factor. If it is mild, intermittent, they've never had any hospitalizations, they may have to use their pump once every 3 or 4 weeks in the winter and the spring. I probably wouldn't consider that an elevated risk at this point, okay, if you're wondering. Okay, so that's the evidence that we have at this point. The control measures that we know that maybe you can help with, masks work. So 2 and above should have a mask on. I know that this seems daunting. You can help your kids, teachers, by getting them ready to use a mask and wear it. Maybe have a fun character, have them choose it, maybe make some decorations hanging from it. But get them used to it so that the teacher is not the one that's responsible for doing that, because that's not, I don't feel like that should be their job. And then, of course, hand washing works. Hand wash, you can't control the school environment, but hand wash before you go to school, and then hand wash as soon as you get home and change clothes right away when you get home. Temperature screening, although not the be-all, end-all, has some value. So look for, if you're going to a daycare, look for places that are temperature screening and also masking, having the workers mask. And also a note for daycare, if it is a mixed age group, if you have a kid that's non-ambulatory, likely below 9 months, it would be great to have caregivers who are taking care of those kids, only take care of those kids, and not have them mix with that 1 to 5 year crowd that is all over the place and touching everything. And, because that's just daunting. And it's just an extra layer of protection. And then please do not send any child to school with suspicious symptoms: fever, sore throat, cough, runny nose, diarrhea. And please, I know this happens in years past. People give Motrin or Tylenol for a low-grade fever so that they're fine to be in school. But remember, when you're doing that, you're definitely potentially endangering lots, other people. Okay. So let's talk about what should go into your decision to go, to go live, to go in person, or to change that scenario. Okay.
Dr. Cao, do you mind if I remind everybody that if they want to ask questions, instead of using the chat, the comment, please use the feature, the Q&A feature, which is this little icon with the question mark right there, because as soon as Dr. Cao is done with his talk, then all these questions will be asked.
Which one is the question mark, Mateo? Is that the airplane?
There is an icon at the very bottom. At the very bottom here, there are a few icons, and one of them has, it looks like a little card with a question mark on it. And that is the feature that I would like for everybody to ask. I've been receiving plenty
You're
of
getting
questions
them?
in the
Okay, so
meantime.
I don't see it on mine. Okay, fine.
Yeah, so Lorena, and that's probably because you're with me right now.
Okay, fine.
Lorena, if you can send me this question that I see in the comment, because it's going to be really difficult to find it in a little bit, send it directly to that feature. Sorry, Dr. Gao, go ahead.
Okay, fine. So let's talk about what factors should impact your decision. So you have to think about your family, anyone who might have adults or kids who might have risk factors, obesity, diabetes, hypertension, anyone who's immunocompromised, anybody who has lung or heart issues. So you have to consider that, and if you're going to have exposure to them. And then also, if you're going to plan on visits with anybody who, if you're going to travel to Michigan to see grandma and grandpa who might have had a bypass last spring, or had a lung transplant a few years ago, you do have to be, you have to be a little bit more on the cautious side. And then the other thing to take into account is that until we know, like, we have good screening, just know that every virus, anybody with viral symptoms in this early fall is going to have to be addressed as potential COVID. So, swabbing and then returning to school after, 10 days past the initiation symptoms, 72 hours fever free. Know that is quite a possibility. And we all know how frequently kids are passing viruses. I suspect it'll be less this year, but it's still going to happen. And then the other thing to do that I've been recommending that people gauge is the positivity rate in New York. We're doing wonderfully in New York at hovering just around that 1% mark. And for us to stay in-person school is going to be, as far as the plan outline, is going to be the 3% mark. Unfortunately, one of our neighborhoods, Sunset Park, right now is at 7%. So for whatever reason, so people in that neighborhood, please be careful. Okay, practice the social distancing and hand washing quite aggressively at this point until we know that the numbers are decreasing. Okay, but while we're lingering around that 1% mark, know that the likelihood of your kid going to a facility, getting exposed to someone else is much lower than it was in March or April, when we were above that 7% line. So how I approach it is, when we open up schools, when we have any laxing of restrictions, my approach is to wait 2 or 3 weeks, look at the new cases or the positivity rate. And right now, positivity rate in New York City is like 1%. New cases we've been very fortunate. We're lingering in that 150 to 400 new cases a day in New York City since early to mid-June. So if it stays at that level, feel confident continuing doing what you're doing. If you start to see an upward tick, then maybe consider changing your situation. Okay, I hope that makes sense.
It's a lot of information, and thank you, because I think it was very comprehensive. Okay. Should we start the Q&A?
Yep, let's.
Are you ready for it?
Yeah,
okay.
I'm sorry, my hands, I'm trying to hold this with my battery went out, so.
Oh, great. All right, so let's start with something on the simpler side, but also, a very important question as well. First of all, is thoughts on masking in a 3s program. Should it be enforced? This is asked by Becky, our friend Becky. Here we go.
Right. So yeah, 3 is a tough, that 2, anyone above 2 should have it on. 3, excuse me, 3 and above, that wasn't COVID, I have allergies.
It's amazing how you have to be clear.
That 2 to 4 year crowd is going to be the challenge with the masks. I would feel better if they're indoors to have a mask on, but if they're outdoors and have a private outdoor space in their preschool, I would feel much better. I'd feel more comfortable that they were unmasked at that point. But inside, I would still prefer that they had it.
Awesome. And then the next question is always about masks. Melinda is asking, should we send multiple masks with the kids into school, or so they can swap their mask during the day, or is one mask sufficient?
I think one for the day is fine. You really should, each kid should have like a mask a day for the week, and then do the laundry at the end of the week. It should be washed after a day's use.
And then Jackie's asking, hi Jackie, should we cover kids' hair when we send them to school?
Honestly, fomites and particulate transmissibility is less of an issue than we thought it was in March and April. If you do have the option for a bun or a ponytail, I would prefer that than having it all out, getting on other surfaces, and then bringing it home and potentially touching that surface and then touching your eye or your face, just to be on this side. But it really is less of a worry than we thought it was in March and April.
Thank you. And then Mommy to toddlers. She has 2 years old and a 4-year-old. Is hand sanitizer safe to use with children?
It is. There is, if there's methanol in there, you should check to make sure that it doesn't contain methanol, because methanol can be toxic to the liver.
And then we have a question about, I think this is daycare, right? 3 years old. If your child is only going for socialization more than academics, for example, a 3-year-old, is it necessary to go, or is it better to keep them home?
Well, I think, I didn't touch on this, but the AAP's stance on it, when they're trying to figure out a guideline, the things that they took into account were the bigger social factors, meaning the what is it, 6 million kids in abusive homes, 12 million kids who are food insecure, and of course that plays into it. So I could see where they lean that way. And then there are also kids who have sensory issues, or who need a see-it, or who need extra attention that we cannot give at home and still provide a similar learning experience. As far as just pure social ability, I'm not so sure that a season of missing out is going to have strong ramifications. Even academically, I don't suspect that. Some of you guys know me. I missed out on school for 6 to 8 months when I was a refugee, and I don't remember doing any math during those 6 to 8 months, that window. But eventually we caught up. Like, my take on it is, does it matter to you if your kid can do fractions between, at 9 or fractions at 10? It's not a big deal, right? So know that kids are very resilient. Of course, the sociability is going to be a plus, but I'm not so sure that a little glitch in there is going to have any long-term consequences.
Right. And I think that everybody, I mean, speaking as a parent, right? I'm just your husband. I'm not a doctor. But as a parent, I mean, we have seen it too, that the lack of socialization for our own daughter, you know, also meant that there were little, you know, little more discussions at home or frictions or things like that. You know, it's hard for parents for sure. So this is, I mean, let's restate it again. This is a real, like, personal decision about going back to school or doing full remote, depending on the structure of your family, depending on what you can afford to do, you know, what your job situation is, and all this, right? Let's move on with the next question. If this will work, yes, it does. So the next question is, let's try this one here. Should kids stay home if they only have a runny nose but no other symptoms?
Yeah, that's a tough one, especially going into allergy season, right? I think if you go with a runny nose, you're gonna get sent home, and then it's gonna be put on us to clear you. And there's like, what are we supposed to use as our tools to clear other than we'll send you to one of the places to get swabbed, and then you have to wait until it's negative to attend school clearance again. So it's gonna be a real conundrum. I'm sorry, I don't have an easy answer for that.
It's really tough to have an answer for that. Patricia is asking, do you think there will be a rise in cases when the schools reopen?
I have my suspicions. So that's why, as I said earlier, you know, watch the on NYC.gov, they have the curves. So watch for the new cases, and they present them daily. So as long as we stay around that 150 to 400 mark, know that we're relatively safe.
And how about, Lucy's asking, does the indoor nature of school concern you?
Yes. One of the concerns is you know, you're much safer, you're much less likely to spread when you're in an outdoor environment than you are in an enclosed environment. The risk is if you're in an enclosed setting, meaning a small, like, you know, a smaller room, and be within 15 minutes of somebody. And then the other factor that plays into it, and I think I touched on it lightly earlier, is the ventilation. You know, around have scaffolding up and down them, so they don't have an option to open the windows, and some of them don't generally open very far at all. So the ventilation is not particularly fantastic.
Right, and most of the schools, especially, you know, the one that we know at least, are kind of old and really, first of all, they don't have a proper ventilation system to start with, because they've been built, you know, a long time ago, and most windows.
Well, let's just say I love New York City schools. I think they're very charming in their oldness, but in this situation, I'm not so pleased.
Mm-hmm. Yeah. Let's move on with this. Seth is asking, you mentioned studies on 1 to 5 years old contracting and spreading the virus, right? Are there similar studies for under 1?
Well, you know,
I think we lost you for a second, Dr. Are you there? I think we have a little connection problem. Let's see if we can find a way around this. Are you there?
It was a telemarketer.
Oh, yeah.
So, you know, yeah, sorry. No, I got a telemarketer phone call. So sorry, I'm not your IT guy, folks. Sorry. So the 1 to 5 year crowd that was a generalization. They just don't, they're ambulatory. They don't know their boundaries. So they're up in each other's faces. They're, licking their hands or licking. So they tend to spread things more rapidly. This doesn't particularly specifically apply to COVID, although we don't know. It's coming to light that maybe kids aren't giving it to each other as readily as we thought they were, and that they're actually getting it from, if they're contracting it, getting it from adult contacts at home. Under 12, you're not really ambulating. You're not. Your breathing is not as forceful. So I don't suspect that kids under 12, if they have it, or under 12 months, if they have it, are actually particularly giving it to anybody else. My supposition is that they're not.
Okay, so we're gonna close with the final burning question. We have received several, and so we're gonna end with this one. But before we do, I want to ask everybody here who has been live with us, and whoever is going to watch the recording session of this live Q&A, to join our Facebook group. It is free. It's for all our SSP families and their friends, and it's a great resource for the community to have some support and some quick answers. And so the final question is, Dr. Kao, are you sending your child to school this year? We have to ask because we have received several of these questions.
That's fine.
Yep.
And honestly, I've given my plan to a few people in the office who specifically asked. In this forum, I don't think that I only hesitate to do so because it's not because I'm ashamed of it or I'm concerned about what it represents, but I just don't want what I do to have a huge impact on what you do, because what I'm doing is the best fit for my family. So I really don't want to impact your decision, because each of our families is different. So I don't want it to be the end all be all to what you do. I'm not trying to be secretive or anything like that. I just want you to have some autonomy and have some space to make the decision based on your family's makeup. I hope that makes sense.
Yeah, I think you're absolutely right, because we made this decision, our decision together as a family, about what we're going to do, right, for September, because it's also coming. But as a parent, I would have wanted to know what my pediatrician is doing. But it makes absolute sense, because you have that position where you could easily influence somebody else's decision, without really knowing in details what their family structure is, what their possibilities are. And there's no right or wrong answer in whatever any family chooses. Like, nobody should ever judge anyone about what they're choosing, because it just has to do with what you can do at this time. Correct?
And what's best for your family. Yep.
Right, and what's best for the family, exactly. So we want to thank everybody for joining us with this Q&A. We hope that we will see you in the Facebook group. If you have other questions, this will be also posted there as a recording. Thank you so much for watching, and we love you guys. We have an amazing community. Bye. Thank you so much.
Happy Saturday.
You too.
Bye.